My name is Dave Medeiros. I'm the president of the Chesapeake Region Safety Council. We are a regional independent chapter of the National Safety Council. Our mission is to educate and influence people to prevent accidental injury and death. We are also a part of the Mid-Atlantic OSHA Training Institute Education Center. We're the lead with that group of people, and we are qualified or authorized to teach the numbered OTI courses, kind of referencing the OSHA 510, 511. You all are probably familiar with that stuff. Today, we are going to present a very timely topic. It's COVID-19, OSHA, MSHA, and HR concerns. And I want to tell you, we have probably one of the best speakers that I've heard speak over my time as a safety professional, which goes probably about 30 years now. And every time I hear Adele speak, she is awesome. So what I don't want to do is waste a lot of your time, but I do want to tell you we are available, and you're going to see a lot more of this stuff, both free stuff and some that comes out for a nominal fee presented by us, the Chesapeake Region Safety Council. So stay tuned. You're going to hear more from us about an array of topics as we kind of grow into this new way of communicating. Maybe it's not a new way for all of us, but some of us that are full-figured with gray hair, it is a new way. So without further ado, I want to introduce Adele Abrams to you. She is, my goodness, if I were to read her resume, we'd be here all day. So I'm going to let Adele take over and get with you. And I just want to thank you all for participating. I'm looking forward to learning a lot of stuff today.
Okay, and I'm going to close my camera here in the interest of keeping everybody sane here this morning, but I want to wish everybody a good morning and a healthy morning, especially as we go through the wild world of COVID-19. So let me get this into slideshow mode here, because that's the one thing you can't really do in advance, and we will be ready to rock and roll here. Again, thank you to the Chesapeake Region Safety Council for giving me the opportunity to share this information with you. And I think probably the simplest thing I can say as an overview is I'm sure most of you have whiplash, just like I do, because it seems like the guidance is coming out on almost an hourly basis, depending on which agency you're looking at. And then the guidance is contradicting itself to a certain extent. What is a poor safety and health professional to do? Well, I'm going to try to at least give you some overview of where we are and where things may be going, and then what OSHA and MSHA and a little bit on DOT are looking at. So that's what the game plan is here for us this morning. First of all, and I think this is important to start out with, and I know we have a very mixed audience here. Some are construction, some maybe healthcare, some are retail or manufacturing. And I'm going to try to give you the perspective for the different industries that we're talking about here. But starting at the top, OSHA does not have an infectious disease prevention standard, and I'm talking federal OSHA now. I'm going to be speaking mostly federal OSHA, but obviously Maryland and Virginia, out of the Chesapeake Region Safety Council's jurisdictional areas, they are state plan states. And so I'm going to talk a little bit later about Cal OSHA, and pay attention there, because just like California can go out and be more stringent than federal OSHA, so too, and in fact have, Maryland OSHA and Virginia OSHA. And so if they determine that there is a need for an emergency standard, they can get out ahead of the feds. They have that ability. So keep an eye on that as we go through here. But OSHA, federal OSHA that is, did attempt to do an infectious disease prevention standard in the wake of the Ebola outbreak that we had, which turned out not to be any kind of real outbreak at all, except in a limited extent in the healthcare sector. But responding to that, the Obama administration did draft a comprehensive infectious disease prevention rule, and they even went through the small business panel, the SABRIFA process, they call it, and got input from the small entity representatives who would be affected by the rule. And who those are is broader than you think. We're going to talk about that as well. But then what happened was we had a presidential election and things ground to a halt. We had a new sheriff in town, as they say. And so the Trump OSHA, at least up to this point, has shown no interest in really moving on an infectious disease prevention standard. And it got taken off of the priority list and placed on what's called the long-term agenda. Those are the rules that the agency doesn't think it's going to have any action on in the next 12 months, which would be through the end of at least this term. Now, the last OSHA regulatory agenda came out in November of 2019, and nobody even knew the word coronavirus or COVID, at least, colloquially as we do now. Back then, it wasn't anything on our radar. And so things certainly may change when they come out with the next regulatory agenda, which is due pretty much any time now, but will probably be delayed because of COVID-19. But recognizing this, the House Education and Labor Committee, which used to be the House Education and Workforce Committee, old habits die hard, they did get active on this. First, they sent a letter to Labor Secretary Gene Scalia, of course, with a copy to OSHA, asking them to do an emergency standard. And they got no response. So legislation has been introduced now, and I'll talk about that in a moment. But if OSHA declines or is not forced by Congress to do an emergency standard, not specific to COVID-19, but more of a broader standard that would cover COVID-19, it would cover Ebola, it would cover H1N1 or any other mutant, viruses that are transmissible through respirable means in the future. They would have to go through the normal rulemaking process, which means publish it in the Federal Register, accept comment on it, hold public hearings, etc. And it would likely be considered a major rule because in all likelihood, it would have more than $100 million in economic impact, which means that if they do the normal rulemaking route, it would trigger the Trump executive order of every rule that comes in, they have to eliminate 2 existing rules of equivalent or greater value, or cost would be more precise. So whether there would be a waiver in the wake of a public health emergency and pandemic, who knows? Executive orders can be written by the president. They can be rescinded or modified by the president. So he does have that power. Now, in the Ebola crisis, the big union, the AFL-CIO, had requested expedited rulemaking, and OSHA declined then, but the response was drafting that rule in 2015. This does not mean, however, that OSHA is weaponless against employers who willfully, recklessly, or knowingly expose their workers to COVID-19 in the workplace. They do have a number of tools in their arsenal, and we're going to go through what those are here a little bit later in the presentation. Now, in the meantime, OSHA has also put out guidance intended, largely to help small businesses, but it really is applicable every place. And it is definitely worth a read. This is one of these OSHA booklets that really is worth the paper it's printed on. Most of them are. I think they do generally a good job on it, and I'm going to give you the links to that in a second. But it's important to know that came out on March 10th, and now we are just about a month further, and already the CDC has changed some of their things. OSHA itself has changed some of the requirements on respirators. And so when you go back and you read that 35-page document, remember, it's already dated to a certain extent, but it is based on traditional infection prevention principles and industrial hygiene practices. So, if you are on this call and you are an industrial hygienist, you probably already have a pretty good idea of what you need to be doing. Now, let me talk about COVID for just a moment. First of all, when I've been giving this webinar a few times, and typically I would have I hate to say it this way, a body count in there. I kind of gave up because the first time I gave this, the death count in the US was at 500, and we are now almost at 13,000. So it's bad. It's real bad. It's getting worse. We have over 400,000 cases here in the US at this point in time. And there's lockdowns all over the place. Now, this is where I want to tell you that you need to look at what your individualized states are doing. Given the time that we have together here this morning, there's no way that I could cover, all of the states. But just for example, Delaware, where I happen to be located right now, the governor has put out guidance for employers requiring you to take temperatures using the touchless thermometers before people can come in. And if it's 99.5 or higher, you're not supposed to let them come in. Obviously, there are states that are classifying some businesses as essential services and some that are non-essential. If you are non-essential, you should not be operating, period, hard return. If you are essential, then you still have the obligation to protect your workers. And you can't say, well, we're essential, and so it's kind of like 9/11, we're just going to charge in there without respirators on. No, no, no. OSHA is still working. MSHA is still working too. And ironically, I saw one statistic. I was kind of searching for this about complaints from workers about the hazards. And just in Oregon, which is a state plan state, Oregon OSHA had already received over 1,000 worker hazard complaints about, failure of their work or their employers to take adequate protections for them. So I'm sure this is going on in the local and regional OSHA offices all over the country. The question is, are they going to be deploying their resources to inspect that? If there are clusters that break out, absolutely. And we're going to talk about reporting and recording to OSHA here in a little bit. But the bottom line is this is a respirable disease. Bloodborne pathogen protocols are still good things to follow, but that is not going to protect you from COVID-19. Moreover, again, as increasing information becomes available, it now seems like there are an awful lot of people who are positive for this but are asymptomatic. And so, taking the temperature like Governor Carney wants in Delaware is not going to solve that issue. Somebody can have no temperature at all and still be positive, still be contagious. The symptoms can be mild. They can be deadly. This morning I'm mourning the loss of one of my favorite artists, John Prine. But I also already know one person personally who has died from this. My husband knows another in Maryland, a member of the public school faculty. So, this is touching us all, and it's very unpredictable. In the safety field, we tend to talk about younger workers being 10 feet tall and bulletproof, or at least feeling like they are. And I think there is still some of that going on for those people who feel they are younger, they're healthy, they're invincible. You can get it, and it can be very serious for you as well. Again, anecdotally, but my cousin who lives in Baltimore, who is in his early 40s, told me about a high school friend of his, very athletic, very healthy, who is intubated right now. So it is happening. It's not just the oldsters that are being affected by this. Conventional wisdom says the symptoms appear 2 to 14 days after exposure, but we know that there can be no symptoms. And we know that in some people, you can have symptoms develop longer than 14 days after exposure. So we are learning more and more as time goes on. Again, conventional wisdom is the 6-foot rule. I was trying to figure that out. Most of our arms are somewhere around 3 feet. So if you stand and you're reaching out and neither of you can touch each other, that's probably 6 feet or more if you don't carry a yardstick around with you. But, can it go further? We really don't know. I think staying more than 6 feet away is probably prudent. I think about tall people like Dave Medeiros, coughing or sneezing, and somebody short like me being in the vicinity, is that going to be raining down on my head? And so you've got to be thinking about, your situational awareness, I guess is a good way to put it. How is it spread? Obviously, through the eyes, through the nose, through the mouth. If you touch objects that can be potentially contaminated, and then you touch that T-zone, which is nothing sexy, it's just the eyes, nose, and mouth, that is one route of transmission. So, okay, we're wearing masks. That keeps us from touching our faces. But when you take the mask off, it's probably contaminated on the outside. And then if you lay it down on the table, you've infected another surface within your household. If you then touch your face, one of your T-zone spots, before washing your hands after removing the mask, once you get home from your ninja shopping excursion, you have potential infection route there. Packages, some people are really going to the extreme. I've heard of people who are literally taking everything out of the package and putting it into a plastic container before they put it in their refrigerator. I'm not going that far, but I am trying to open most of our packages outside of the house. I am washing my hands a lot. You don't have to buy stock in the alcohol sanitizer businesses necessarily. Soap and water does just fine if you have access to it. But certainly the hand sanitizers are a good backup for that. So when we come to the workplace, employers have to look at, first of all, their existing infectious disease control plans, if they have one. If you are in the healthcare sector, most assuredly you do. If you are a first responder, clearly you would have some plans and training dealing with that. There are other certain industries that generally, will capture all types of potential emergencies. Maybe you're following the ANSI Z10 program and have thought about this type of thing in advance. But you'll need to consider, is your plan adequate now? Have you considered all of the specific exposure risks, the sources of exposure, these things we're talking about? Have you accounted for the person, if you're an essential business, in your mailroom? Maybe you're a construction company and you're giving all your guys out in the field the protection they need, and you're not thinking about the clerks that are processing your mail and your packages. So those are some things to think about as well. Community transmission. What are your risks? If you are an essential business, members of the public are going to be coming into your stores or picking up food at your curbside delivery. You're going to have to consider how you are controlling those risks as well. And then the unique characteristics of this, some of the things that we've talked about, which is that you can go from zero to death pretty quickly, it appears. And some of the symptoms may seem very minor until suddenly they aren't. Now, if you don't have a current emergency response plan, you need to build one. And you need to anticipate what the failures potentially are in your unique workplace from your lack of contingency planning. A couple of points that I like to raise are we are trying to, in many cases, do the same amount of work with fewer people. You may have supervisors who suddenly are filling in for your hourly workers because the hourly people are out sick or they're quarantined caring for a family member. And it's very tempting to think that if you're the supervisor, you know how to do it all because you've been telling other people that they're doing it wrong. But then you jump into the situation, you operate the tool or you operate the equipment without refreshing your training on that. And that's when things go sideways. I have seen an awful lot of fatalities. I've handled over 300 of them. And very often the ones involving supervisors happen when they are filling in for people. So if you have JHAs, job hazard analyses, blow the dust off of those binders and, crack the spine on those bad boys, read them. In the mining industry, there's a campaign they had a while ago called SLAM, Stop, Look, Analyze, and Manage the Risk. That is a really good snapshot of an approach to take if you're doing something you haven't done in a while. But also remember, some things like forklift operation, that requires certification. That requires current training. And if you operated a forklift 10 years ago, back before you got promoted, you can't just hop on that and start loading trucks from your docks. So be very careful about that. You also want to consider fitness for duty. And I'm not just talking about alcohol or drug abuse, although certainly people who are freaked out over this may be using or abusing drugs or alcohol more than they would under regular circumstances. But I'm also talking about the stress factor. When workers are stressed out, distracted, that carries over into the workplace, and that can be quite impairing. If people aren't sleeping and they're fatigued as a result of being up worrying about a family member, or just being paranoid about whether they're going to get sick, or that cough I just had, is that the end? Um, a lot of us are having sleep disruptions now. And if you are working in a safety sensitive job, that can carry over into the workplace. But you've got to consider, the fatigue factor of stress, the physical factor, but also that emotional fatigue and stress that people may be feeling that may put them off their game just enough to make them a hazard in the workplace. So my recommendation is really concentrate on fitness for duty. I'm going to talk about drug testing a little bit later when we get to DOT, but I just want to reinforce, in case you tune out early, workers are now refusing drug tests because of fear of going to the clinics and the fact that it's going to be exposing them to COVID-19. Mobile testing services certainly can be a way to go to eliminate that if you can find a way to make those available. But this is where employers may want to be a little circumspect. DOT, we will talk about, because that is a unique thing. But barring that, you may want to not be sending your people to an urgent care center to have a drug test done just on a random basis, for example. Pre-employment, you may not be hiring right now anyway, but again, be thinking about the exposures that you may be asking people to put themselves through. And a refusal, even under DOT, you have to consider the circumstances, the mitigating circumstances, before reporting them directly to the DOT as a refusal. So these are just a few of the issues to think about. Now, as I mentioned, OSHA does have a few weapons in its arsenal that it can use to cite employers and hold them accountable, even in the absence of an infectious disease prevention standard. I mentioned that booklet, the 35-page one, and I've got the link to that there. And again, it's a month old. So make sure that you are going to that other link, which is the COVID-19 information page, also shown in the slide here, because that will have the more current things, such as allowing expired respirators to be used, allowing now some use of the KN95 respirators, which the EU has been doing already. But understand that, OSHA is making some accommodations in the healthcare sector that may not carry over to construction, for example, in terms of waivers of fit tests. So you've really got to parse your way through this information to make sure that it is applicable to your unique workplace. But OSHA's guidance, it talks about safe work practices. It gives you some guidance on personal protective equipment based upon doing some triage in terms of the levels of exposure. So whether you are considering yourself to be a low-risk industry or you're very high risk, like a hospital or a nursing home, you need to take a look at this. Is that going to be imputed to you, the knowledge of that, for OSHA enforcement purposes? And the answer, I'm going to give you the good equivocal lawyer answer, which is maybe. OSHA typically has disclaimers on there saying this is for guidance purposes only and does not constitute a law or binding rule. And that is true. But although OSHA cannot ding you with knowledge just because you went on their website and clicked on a link, they're not quite that devious where they're charting who is logging in and what you're looking at. As a practical matter, if you belong to an industry association and they are disseminating information, heck, even if you're on this webinar today, and no, don't all go clicking off, there are many routes. At this point, any employer who tried to claim to OSHA that they were not aware that COVID-19 was a health hazard in their workplace and therefore they didn't see the need to take any precautions, the judges are going to be laughing at you when that comes to trial. And that kind of willful ignorance, you cannot escape liability by playing ostrich and sticking your head in the sand or sticking your fingers in your ears. So, pay attention. The more information you have, the better decision making your company will benefit from, and the more your workers are going to be protected. And that's really what it's about. I mean, as a lawyer, I talk a lot about preventing liability, and as a safety professional, I talk about preventing workers. And the best possible is that win-win situation where you're not creating any liability and your workers are being protected. So that's really our goal here. Now, again, as I mentioned, OSHA is actively responding to hazard complaints. If workers say, nobody's wearing masks here, we're having to work, elbow to elbow on a conveyor system, and the guy next to me is coughing like crazy and sweating like a pig, OSHA will, if they have the resources available, come in, because those type of hazard complaints have priority over programmed inspections and over national emphasis program inspections. They are, a step down from responding to fatalities and actual injuries and illnesses. But after that, they are going to be a significant reason that they're going to deploy inspectors. Also, whistleblower protections. And let's not forget that whistleblowers do have protections not only under Section 11C of the OSHA Act, but also under the codified electronic record keeping rule, which took effect in 2016, and provision 29 CFR Part 1904.36 incorporates by reference Section 11C. So if you choose to file a complaint with OSHA under Section 11C, you have 30 days to notify the agency. And if they accept the complaint and go forward with it, you can end up in U.S. District Court, and they can award punitive and compensatory damages. There was even a case in Pennsylvania last year where 2 whistleblowers got over $1 million in a case that OSHA brought against their employer. So it's not small potatoes. But if you miss that 30-day statute of limitations, you do still have other options now. And that is notifying OSHA under 1904.36 that you have been retaliated against for protected activity. And in that case, OSHA has 6 months to investigate and issue a citation. They can fine the employer up to $134,937 per affected employee. Now, where does that leave the complainant? Well, as part of the abatement, OSHA could order you to reinstate that worker or to give them back pay, restoration of seniority and benefits, et cetera, et cetera. So you do have a few options there if you are on the employee side of the equation here. And I know some of you are on this call. So for example, those of you working in a hospital, you are, if you are private sector, you are covered by federal OSHA and state OSHAs. If you are public sector, you would only be covered if you are in a state plan state or a state that has adopted public sector coverage. So you're going to have to parse out where you fall on that whole regimen. And people like the postal workers, there's been a number of them now who have been testing positive, and that is a quasi-public-private partnership, but federal OSHA does have jurisdiction over it. In Maryland and Virginia, public sector workers would be protected. In Pennsylvania and Delaware, they would not. In New Jersey, even though that's federal OSHA, they would be, because there is a public sector state law that would cover you. So again, you have to understand which laws protect you and which agencies to call. But even outside of the healthcare sector, workers have protection if they are being exposed to a hazard, they complain about it to the employer, and they are retaliated against. That is protected activity. So if you complain because there's no, running water and there's no soap to wash your hands and there's no hand sanitizer, and you notify OSHA about that, and the employer fires you or retaliates, that is actionable. And if you go to the employer and you tell them you think you have COVID-19 and you caught it on the job, and they were to terminate you or retaliate against you, again, that is protected activity. I'm going to again interject here, read your state laws, because in addition to these overarching protections under OSHA Section 11C and 1904, some of these new emergency declarations that the states have put out have protections for workers as well. Pennsylvania is one of those where you can't just fire somebody because they have COVID-19, or because they are under a mandatory quarantine. So you really need to, your homework assignment, you really need to go look up the state declarations and the provisions applying to employers in each state where you are doing business. Now, in terms of OSHA's guidance, they looked at initially, again, as I said, some of this is dated. Initially, they were looking at people being at high risk because of interfacing with travelers from abroad. Well, we don't have travelers from abroad anymore unless you consider crossing from Delaware into Maryland or Virginia into Maryland being such. And I literally just got a notice from my homeowners association here in Delaware saying people are scouting for out-of-state tags, and you can't be here just for a short-term rental, which I'm not, by the way. But it's kind of scary if you start having vigilante squads in the neighborhoods going after you because of which state your license plate is. So don't do that either. That vigilantism is definitely wrong. But OSHA initially, in their guidance, they were focusing on the healthcare sector, obviously, the death care sector, kind of a euphemism, but we all know what that is. That's your funeral homes, your mortuaries, people who provide ancillary services, to those transporting bodies, for example. Right now we're not doing much in the way of memorial services, which is very sad. But OSHA was looking at people like the beauticians who come in and do hair and makeup for the deceased. Those are people who have exposure. The laboratories, of course, that are handling biological specimens, and the medical examiners, the people in the travel sector, airlines, trains, obviously transit now, we've expanded that, your bus drivers, people working in hotels, including not just your front desk clerks, but think about your janitorial services, the maids who are changing the linen, the catering services, the valets who are hopping into your car and parking it if you have the misfortune of having to travel during this and stay in a hotel. So there's a lot of ancillary exposures we typically don't think about. Border protection and, by extension, any security, they are your first line of defense. We've had people in TSA testing positive now at BWI Airport and at Dulles. So they're not immune either. Waste management, your porta potties. If you have porta potties, remember this can be transmissible through feces. And one of the things they're talking about is cleaning those out after use. Good luck with that on the construction and mining sites. I've been in those things. But it's, this is one of the changes that as an employer you need to consider. And if you are in the business of pumping those things out, clearly your workers are going to be at an elevated risk. And then any business travel non-essential business travel at this point has pretty much been suspended anyway. I mentioned the legislation that was introduced in Congress. It is still pending. There was a run made to basically take this legislation and include it in the disaster relief legislation. And it was in the House passed version, but it was not in the Senate bill. And so it is not in the version that was enacted to provide a lot of the relief to businesses, et cetera. There is likely going to be another iteration, which I guess will be the fourth now, COVID-19 legislation. And everything I'm hearing is they're going to try to ram this through and force OSHA to do an infectious disease rule very quickly. I heard as little as 10 days following enactment. To be fair, they have a rule already written that's been through the feedback process from small business. It would not be that difficult to pick that up and put it in place as an emergency standard. And similarly, Cal OSHA has a rule, an aerosol transmissible disease standard that has been in effect for a few years. And that is something that, were they inclined, OSHA could adopt fairly quickly. Do I think that there is a lot of enthusiasm in the current OSHA for adopting a new rule? No. But these things can be kind of funny, especially, when constituents start clamoring for it. And when we have senators themselves now, for example, who are getting sick with this and are seeing perhaps firsthand what healthcare workers are being exposed to, or may have healthcare workers in their family, as I do, and as I'm sure many of you do as well. So this could be one of those rare things where there could end up being some bipartisan enthusiasm if things get worse. Right now, though, OSHA is still resisting an emergency temporary standard, and they have that authority to do an ETS where workers are exposed to a grave danger from new hazards. And this is truly a unique hazard in its name. It's a novel coronavirus, and we're learning more and more about its transmissibility and protections that are efficacious as every day goes on. So, the chances of this being enacted as a standalone bill between now and the end of the year, I'd say slim to none. But the chances of it being perhaps included in a must-pass bill, stay tuned on that. Now, what does OSHA currently have as ammunition that they can use to keep you accountable? First of all, there is the general duty clause. And as I mentioned earlier, OSHA has to look for ways to impute knowledge to the employer that something is a recognized hazard. Then they have to have employees who are exposed to that hazard, and there has to be a feasible method of abating the hazard. And at this point, if you are an essential industry and you are continuing to work, no doubt you have knowledge that this is a recognized hazard. You are going to have people who are exposed, whether they are on the front lines, as I said, at the local pharmacy, handing over prescriptions, they're at the grocery store, stocking shelves, or dealing with customers directly, or in one of the other, myriad facets of business that are staying open. You have knowledge, there is exposure, and then OSHA's guidance that they've put out to date, plus they could point to the Cal OSHA rule to show that it is indeed feasible to manage these risks in the workplace. But beyond that, there are numerous codified standards that also are on point here. The first one is the general industry rule for general personal protective equipment, 1910.132, but they do carry that over into construction. Obviously, maritime has similar requirements, and that requires you to do a written hazard assessment for any task that's going to require personal protective equipment, and make a note of what the appropriate PPE is. This is something that OSHA's field operations manual says the inspectors must ask for as part of a comprehensive inspection. And so it's low-hanging fruit, and especially in these days, if you have not included precautions for COVID-19 and revised your written hazard assessment, you could probably be found to be in violation at this point. And the flip side of this, and I just went through this with a client the other day, is if you mandate the use of N95 masks outside of the healthcare sector I'm talking about now, say you're a manufacturing facility, then you as the employer are kind of acknowledging that you do have COVID-19 as a risk. Okay, fair enough. But also, you're making a determination that an N95 respirator is going to be adequate to protect those workers. And, you may have some liability there if that turns out not to be the case. Or already in the healthcare sector, they're talking about N99s, N100 masks. The N95s, just that, they're effective in screening out 95% of the particulate matter. And when you're talking about respirable crystalline silica, that's pretty good. When you're talking about a disease that can kill you, maybe not so much. So if you're doing this on a voluntary basis, I'm going to talk about that a little bit later. That's one thing, but if you're mandating it, you're making some findings there from an industrial hygiene perspective, and you better be able to back them up. There's also an OSHA rule on eye and face protection. Again, because the eyes are part of your T-zone, if you're in a high exposure area, wearing safety goggles, preferably with side shields, going to be a good way to go. You might want to have a full face shield on. We're seeing those again in certain applications. Then you have the big enchilada, which is 1910.134, the respiratory protection rule. And there's a lot to that. I'm going to hit on it as best I can in the time that we have here. But the short answer is, once you mandate the use of respirators, you are under that standard in full. That means training. That means respirator selection appropriate to the task and the working environment. That means, a medical evaluation for your workers who have to wear it. And if they cannot safely wear the respirator, maybe because of age, they've got breathing problems, maybe for religious reasons, they can't shave their beard, or maybe for health reasons, they can't shave because some individuals get ingrown hairs and that can create painful boils and infections, etc. In those cases, if you're mandating a respirator, you're going to have to accommodate that under the Americans with Disabilities Act or under Title VII for religious discrimination, and possibly give them a PAPR, a helmet approach to things, basically a hood, so that it's not as confining. Typically, those with respiratory problems can more easily wear a PAPR. So again, before you mandate it, think about the ripple effects of that and what it might require. And then hand protection. Is this transmissible through the skin? Probably not. We don't know that 100%, but that does not seem to be one of the routes of transmission. But if you get it on your hand and you touch your mouth or your nose or your eyes, it can certainly be transmitted that way. It can pass from person to person by hand contact. And so gloves, just to protect you from the transmission, may be one approach, but wearing the right type of gloves. In construction, very often workers are going to wear, some kind of fabric gloves, leather gloves, cloth gloves. But another hazard associated with COVID-19 is the repeated use of cleaning products. And those type of cotton gloves, if you're using bleach a lot or some other, cleaning material, that can soak through and cause dermatitis. We are in a brave new world. You'll see the HAZCOM standard is on my list there. Now, typically, household cleaners, the things that we all have under our sinks at home, are exempted from the HAZCOM rule as commercial products. There have always been some exemptions for things like janitorial services who are using these products in a way different from how Harry or Harriet homeowner would use them. Well, in this case, you may now be asking your office staff, for example, to be decontaminating all of the surfaces multiple times a day. And if they are using these over-the-counter cleaning products in a manner that is now different from how a consumer would use it, it's going to fall under the HAZCOM rule. And that's where, again, providing the appropriate gloves based upon your review of the safety data sheet with the affected worker is going to be important. Determining if respiratory protection might be needed, if they're using ammonia or something. Be careful. People also need to read this with an eye toward mixing and matching these cleaning products. If you are not a skilled janitorial worker, you may not know that certain products mixed together can create very noxious gases that can severely injure or even kill people. There are certain things you can mix together that are going to go boom, and you really don't want your employees playing chemistry at your expense in your workplace. So keep an eye on the HAZCOM rule because that is definitely implicated here. The sanitation issues, I mentioned the porta potties earlier, but also and I hate to even have to say this, but make sure that you have running water, you have adequate soap supplies, you have towels, paper towels, ideally disposable, to wipe your hands off with, trash containers with lids so that people can put those in, they can get rid of used tissues, etc., in a safe manner, and then try to treat these things as if they are contaminated. Again, whoever's emptying your trash should be wearing gloves. Treat it as a biohazard because you really don't know what's going to be in there. But sadly, I have even had some manufacturing clients in the past cited where they didn't provide hot and cold running water for their people, or the soap dispensers were always empty, and employees called OSHA about it. Now more than ever, that is something that if OSHA hears about it, they probably would prioritize that as a visit to your site. There's also provisions dealing with the medical records access rule. Again, if you haven't been wearing respirators up to now, and suddenly you decide everybody's going to wear an N95, you are going to be subject to the medical records access rule in terms of keeping the medical evaluations and the fit testing records in accordance with 1910.1020. Finally, there's the chemical hazards in the laboratories, biological hazards as well. And what we talked about earlier, which is the whistleblower protections in the electronic record keeping rule. But also remember that OSHA requires you to notify them within 8 hours of any fatality that is work-related or any illness or injury that requires inpatient hospitalization, an amputation, or the loss of an eye. So in this case, do you have to notify OSHA if somebody becomes hospitalized, was one of your employees, and had exposure to COVID-19 in the workplace? And in my view, the answer is yes. If you guess wrong and you don't, it's a $5,000 mandatory minimum penalty. For those of you who might do work at mine sites like cement plants or stone quarries, MSHA has a 15-minute reporting requirement for fatalities and any illness or injury with a reasonable potential to result in death. So if someone collapses at your sand and gravel operation, or maybe you're a contractor and you're working at a mine site and your worker collapses there, you have to notify MSHA, not OSHA. 15 minutes, and it's a mandatory minimum penalty. It's up to about $6,500 now. And a recent court decision held that because that was a statutory minimum, the judges cannot even reduce it. They can't approve a settlement for a lower amount. They cannot, at trial, lower the amount of the fine. They can increase it all the way up to 270 grand, but they cannot reduce it. So mistakes made at mine sites in terms of notifying the agency can be very, very costly. In terms of putting it on your log, I'm going to circle back to that a little bit later, because reporting it is a bit different. With the log, you have 7 days to really sort it out and determine if it's work-related. But if somebody collapses, it could be COVID-19, it could be non-work related, maybe it's work related, could be something else, maybe heat stress, maybe they were exposed to a chemical, maybe they had a bad reaction to something in the workplace. I had 3 cases last year where people overdosed on drugs at work and they were taken away by ambulance and admitted in the ICU. The employer still had to notify OSHA because they wanted to determine for themselves and validate with the doctors that in fact it was not a work-related collapse or condition. So just as you need to notify OSHA if people have a heart attack or a stroke in your workplace, you would need to notify them about this as well. Now, the general duty clause, to kind of mine down a little bit into these standards, we talked about all of these elements already, and OSHA has the burden of proving it, just as they have the burden of proving every violation that they issue a citation for. So they have to show the employer failed to keep the workplace free of a hazard to which their own employees were exposed. And this is a nuance you don't have in the other standards. OSHA has their multi-employer worksite doctrine that says you can be cited as the controlling employer, the creating employer, the exposing employer, or the correcting employer. But the exception to that is the general duty clause. So unless your own workers were in a zone of danger, then they would not be able to cite you under this. I will tell you, OSHA gets very creative, though, in how they define the zone of danger. And for example, if you had one person positive in your facility with COVID-19, even if they were a contractor and your workers were in another part of the building, if you didn't have separated ventilation systems or if there were shared restrooms, then you would have to consider that your worker did have potential exposure. The second thing is it has to be a recognized hazard. We talked about that already. It has to have the potential to cause death or serious physical harm. That's probably why most of you are listening today. And there has to be a feasible and useful method for correction. And that's where that OSHA guidance from that 35-page booklet, as amended by their almost daily updates on policy and procedures, comes into play. So general duty clause is the gap filler. And until such time as OSHA promulgates an infectious disease prevention rule, this is the main thing that they would be employing, especially in the healthcare sector. But of course, there are those other codified standards we talked about, and it's much easier for them to make their case on those. In terms of imputation of knowledge to the employer, they will look at any of three different things. And the first is the employer's own recognition. We have had a number of clients asking us to help them write COVID-19 response plans right now, for example. If you have a response plan, which again is a good thing, it still is something OSHA can point to as evidence of your knowledge of risk. And indeed feasibility of mitigation of that risk. OSHA will look at things like industry recognition. If you're a member of ABC or AGC or Chesapeake Region Safety Council and information has been sent out to you, OSHA can use that to connect the dots and show imputed knowledge. And then finally, there's that common sense recognition. And again, unless you're one of the mole people, at this point, it's pretty hard to escape it on television and in newspapers, on the internet, whatever way you carrier pigeon you get your information. So I think that, if OSHA is informed that you're a workplace that perhaps is at high risk for COVID-19 transmission and you are not employing the effective, or at least hopefully effective, control methodologies that the agency has suggested, and you have workers exposed, they will come in and they can issue citations. So we've covered all of that already. Now, how are we going to approach this from a management perspective? It's industrial hygiene or safety engineering 101. You start off with engineering controls. If you can engineer out the hazard, that's the way to go. And, this works very well with things like silica and lead and asbestos. You're using barriers, you're using air filters, increased ventilation rates. For COVID-19, we're getting a little more creative, drive-through customer service options. Is that 100%? Well, it at least is keeping you 6 feet away from the employee at the window, but you're handing your credit card to them, they're touching it, hopefully wearing gloves. So there is still limited exposure, and then they hand you back your bag of prescriptions and your credit card. Now they have handed something potentially that has exposure back to you. So, if you folks are like me, you're keeping one of the bottles of hand sanitizer in your card, and as soon as I get my credit card back, I clean the card, and then I clean my hands before I touch the steering wheel and proceed on. Beyond that, you've got the administrative controls, sick leave policies. I am encouraging, when I'm wearing my employment lawyer hat, the companies that I work with to have empathy and compassion. If you can afford to do it, pay people to be off, and again, be mindful of what the state laws are requiring, what these federal laws are requiring. There are different rules depending on whether you have under 500 employees or more than 500 employees. Do other things like replacing in-person meetings with web-based meetings. I've been talking to people more, I think, since this thing came down than I ever did. Telework. Most of my staff are doing that. Law firms, believe it or not, they actually consider us to be an essential service. And so I have a very skeleton crew in my office, mainly for processing mail, but limited hours. That's something you can do, is cutting down the length of the shifts, restricting people from coming into the office if they are not staff members. That is something that you can do. Beyond that, reducing the number of workers present at one time. I have been encouraging the attorneys who work for me, if they need to come into the office to get files, perhaps doing it early in the morning or late in the afternoon after the clerical personnel have left, to stagger the exposures. Have emergency communication plans in place. You may be open today. You may feel the need to shut down tomorrow, or perhaps the state or county law where you are has changed. In that case, you don't want your workers taking 2 buses and a metro in order to get to your place of business, only to find out that the place is shuttered. So make sure that you have either an email tree, telephone tree, some kind of method. This is a good time, if you haven't done it, to ask your employees to give you updated email and cell phone information as well. You can educate, you can train your workers on your protocols, you can educate them generally on both on the job and off the job safe protocols for them to follow. That's all a part of the administrative controls. And this is a situation where, unfortunately, we're not going to be able to eliminate the potential spread of COVID-19 solely through engineering and administrative controls. And so that's where the PPE comes in for those individuals who are at higher risk, goggles, the masks, and when I say masks, I'm talking about real respiratory protection, and the gloves. Remember, if it is mandated PPE, it has to be paid for and provided by the employer. Now, what about these cloth masks that everybody is making out of bandanas and their old underwear and socks? And I had no idea that, first of all, so many people knew how to sew. And second of all, that, there were so many different ways to make these masks. Okay, I'm going to be a little bit of a naysayer here in the sense that I want people to understand, if you are healthy, putting an old sock over your face is not going to keep you from getting COVID-19, 100%. A real respirator will do that, at least, when worn properly, fit tested, not worn over 3 days of growth of beard, et cetera. That can protect you. That's why we want the healthcare workers using these. And we understand supplies are tight. The cloth masks, in some cases, can be worn over the N95 to protect them and extend their life because, again, at least, before the world ended, those were supposed to be disposable masks. Now they're allowing them to be cleaned. That can be a little bit scary, at least to me. I'd prefer to wear them the way NIOSH intended, but we are in a war. We are in a crisis situation, and so things have gotten a bit looser. Does that mean that the employer is going to have no liability at the end of the day? No, because there's always going to be creative plaintiff lawyers out there who will point to what you did and say you could have been, more prepared. You could have done a bit more. But you want to at least document everything you're doing. And if you're having to have people wear the cloth masks and nothing else, you may want to document the efforts you went through to try to get N95 masks and failed, again, especially if you are in these high hazard industry sectors. Now, if you are contagious, putting the cloth mask on will keep your sputum and your sneezes from potentially going out into the work environment, depositing droplets on plastic or metal surfaces where it can stay for 3 or 4 days, or even on paper surfaces where it could last for 24 hours. So it can cut transmission in that way for sure. And if you're going out in public, certainly you want to have something covering your face just to mitigate exposure. But remember, those bandanas are going to get contaminated at the end of the day if you have COVID-19 in your workplace. And then the question has come up, who's going to wash them? Should the employees be taking them home and washing them? If they're the employee's own bandanas, sure, fine, no problem. If you're furnishing them and the employee takes them home and say their wife does the laundry and washes it, she's at high risk, gets contaminated and becomes ill or passes away. Now you're in that same take-home contamination paradigm that we had with the Libby, Montana vermiculite contamination. Yes, certainly you could defend and say, well, the wife might have, or whoever did the laundry might have been exposed to it elsewhere. But the bottom line is, in my view, it is not a good practice to require workers to take their PPE home and wash it in the home environment where they might be transmitting exposures from there into what has otherwise been a clean and safe home environment. So be aware of that. And then, if you are mandating the use of this, you have that medical evaluation, fit testing. OSHA says 1 day growth of beard maximum. And if you're Richard Nixon, maybe a half a day growth. But you need to be clean shaven for there to be a tight fit for the respirator to work as designed. Otherwise, it's really no more effective than having any other kind of barrier mask on. These are supposed to be inspected, maintained, replaced. You can go beyond the paper dust masks. You can go to a half face or full face respirator. OSHA's never going to ding you for wearing more respiratory protection than is required. But if what you're wearing is not appropriately rated for the hazard involved, they can come after you for that. Now, Cal OSHA, I mentioned earlier that they had gotten out ahead of the feds in adopting a rule. And it is codified in Title VII of the California Code, subtitle 5199. For those on the call, if you are a national company and you have operations in California, you may already be familiar with this. And let me say that if you are already complying with this in California, but you're not implementing comparable protections at your work sites in Maryland, that could tee you up for a citation under the general duty clause because you've already shown that you know how to do it, you recognize the hazard, you have feasible and effective methods of control, et cetera. And the bottom line is you cannot have second-class citizens when it comes to safety. So you have to provide, in my view, from a moral and ethical position, even if we're not talking about the legal part, you can't protect workers in California to one level and then have a diminution of protections for your workers in Pennsylvania or Virginia or Delaware, or et cetera. So what's in the Cal OSHA rule? Well, first of all, they put out interim guidance on this, and it was focused on the healthcare sector. They advise you to review your own procedures, and they have put up a coronavirus or COVID-19 information page. Now, again, for my friends in the mining sector, Cal OSHA is unique in that it is the only state, California, where a state OSHA has concurrent jurisdiction with federal MSHA. Usually it's either federal OSHA or federal MSHA, or a state OSHA versus MSHA. For example, Maryland, that would be the situation. But California, you have concurrent jurisdiction. And so depending upon where Cal OSHA goes in expanding this, there could be some exposure there as well. So what's in the Cal OSHA rule? Well, it's called the ATD standard, aerosol transmissible diseases. And it would address things like COVID-19 because it covers all airborne infectious diseases. The rule as written applies primarily in healthcare. Very similar to what I outlined for you from the OSHA draft standard when they did that SBREFA panel. Your hospitals, nursing homes, clinics, medical offices, home health care, outpatient, urgent care centers, your rehabilitation centers, hospice care, your EMTs, your emergency providers and transport, laboratories, public health services, police services, and that's another sector. Lord knows we are seeing an awful lot of police and firefighters now not only becoming ill with COVID-19, but succumbing to it. So they are covered under the scope of this rule as well. Correctional facilities, again, in Maryland, I believe we've already had prison guards who have tested positive. There are some outbreaks in prison among inmates. This is where it can spread like wildfire. Same thing with homeless shelters. And even in drug rehabilitation facilities and programs, because you have a lot of people there with lowered immune systems due to intravenous drug use who may be more susceptible to contracting COVID-19 and then bringing it into these treatment programs with them. So that's an awful lot of people right there that rule covers. And again, remember, it covers these ancillary services like the janitors and the cleaning people and the food service in the hospitals and nursing homes. But then Cal OSHA left itself some wiggle room, and they included a provision to say that it can apply at any other locations when Cal OSHA informs employers in writing that they must comply with the aerosol transmissible disease rule. So if Governor Newsom in California were to decide tomorrow that they're having really high rates of transmission in the construction industry, he could send a letter out, stating that all construction companies would have to implement a similar standard. So this is very much a fluid situation. You're going to have to stay tuned on this, but my point earlier was that even though the federal OSHA draft rule was focused on the healthcare and death care and those associated industries, they too could ultimately expand the scope of a rule to encompass all employers. And if this rule, if a federal OSHA rule were to get started now but not get completed until, say, after next January, we may have a new administration and the look of that rule could be quite different from what it would be if it is finally promulgated under a Trump administration. So those are some trade-offs that need to be considered. There is a reluctance to do any rulemaking right now, for sure, but getting that rule to the finish line now might end up being a less burdensome or stringent rule in the end. And certainly it is something that people could use some guidance on right at the point that we're at right now. So what's in this rule? Again, there are, I believe, the hyperlinks you can check on this, but you have to have a written plan. You have to do training for affected workers. You have to implement all feasible engineering and work practice controls, then drop down on the hierarchy, as we talked about, to personal protective equipment. Notably, the Cal OSHA rule does require employers to pay for vaccinations where they are available for infectious diseases. We don't have one yet for COVID-19, but if they come up with one in the next year, then that is something that would be required for employers who are covered under that standard. And also, employers have to pay for infection determination and treatment. So if you were to be covered by this standard or something similar, then that is something that you would need to pay for. Most likely it would be covered under workers' comp, but your mileage may vary on that. And there are some specific requirements for laboratories as well. So that is, I think, very much the framework we could be looking at in terms of an eventual federal OSHA rule, or perhaps an emergency standard promulgated by Maryland OSHA or Virginia OSHA, which they could go ahead and do tomorrow without having to wait for federal OSHA to get on board. So where's that future federal OSHA rule? We've kind of captured all of this already. And even in their long-term agenda, federal OSHA noted that the standard could apply to additional places and occupational settings where people could be at increased risk of exposure to potentially infectious people. These days, that could be a supermarket or a drugstore. So, be thinking about that as you envision the scope of a future rule. The whistleblower protections we've covered already, I think, pretty much. But what about work refusals? An employee is entitled under Section 11C of the OSHA Act and also the comparable provision of the Mine Act, which is Section 105C, to refuse to engage in a hazardous task if they believe and have a good faith belief that there's an imminent risk of injury or illness without some remedial measures being taken. Normally, you are required to communicate your concern to the employer. There are exceptions if the employer has shown a lot of animus towards safety matters, and the last 3 people who went to them with a safety concern were immediately fired and blackballed, then OSHA and MSHA will excuse the worker from making an attempt to get the employer to do the right thing. But, if they've never been approached on this before, you can't just walk off the job. You have to give the employer an opportunity to mitigate the circumstances. Now, if there's insufficient time to eliminate the hazard, either through a complaint to the employer or through a complaint to OSHA, then you can leave. And that is protected activity under Section 11C and Section 105C. Now, what about coworkers? That is going to be a little dicier. And again, do you have a good faith belief that you are at risk? Or is there somebody who appears sick? Or are you just generally paranoid about working? These are things that are going to have to be sorted through to some extent on a case-by-case basis. But certainly, if a worker knows that they have COVID-19 and the employer says, fine, just put a mask on and work anyway, the other workers around them would certainly be entitled to raise a complaint, first internally, if the employer does nothing, externally to OSHA, and if they really feel that the risk is extreme and imminent, they would be able to avail themselves of that work refusal protection. And then the direct threat to safety defense under the Americans with Disabilities Act is the flip side of that coin. That's what the employer has to analyze and has the burden of proving if they want to bar somebody from the workplace. Not just the healthcare sector anymore, but really any of these sectors. So to make that defense, you have to have, not just subjective or stereotypical fears, but you have to have objective information that is specific to the employee that you are trying to claim as a direct threat to safety. It has to be backed up by scientific or medical information. And then you have to look at whether there are reasonable accommodations you could make that would either mitigate that risk to the worker themselves or to other workers, you know, or if you cannot accommodate them in some way, then they may be found not to be a qualified person with a disability. Now, if you think about this, what do we have? Well, who's at high risk? You have old people. I hate to put it that way, but I'm in the category there. First of all, persons over 40 are covered under the Age Discrimination in Employment Act, which is a separate statute. And so if you say we're going to recall all our workers under 40, but we're not going to let anybody over 40 or even over 50 come back to work because we think you're at heightened risk, that could be viewed as age discrimination. Now, on the direct threat to safety, if you say, again, you're a worker over 60, and I know I've seen that you use an inhaler from time to time. So in my view, you are at direct risk of this, and COVID-19 in my workplace would pose a direct threat to your safety. So we're not going to let you work. That's where the analysis has to come in. Maybe that person can telecommute or do something remotely. Maybe they can be tricked out in a PAPR so that they would be protected from exposures in the workplace. This is not just a once and done analysis. You have to do an individualized assessment for each of your employees who would be covered under the ADA. That is somebody with a serious health condition that impacts a major life activity. So somebody with chronic COPD, somebody with a history of lung cancer or pneumonia might be covered under that, whereas somebody who is otherwise healthy would not be covered initially. Now, if you are regarded as disabled by the employer, you are covered under the ADA as well. So that's another route of exposure to litigation you have there. So, certainly we could do 90 minutes just talking about the ADA, and we're not going to do that right now. But if anybody has follow-up questions about that direct threat analysis, it's in some ways the same one that you use when you're considering a worker who has to use a prescription drug in the workplace. Are they going to be a risk to themselves or others? And what are you basing that information on? That's kind of the two-prong analysis. And then what can you... Yes.
Adele, I don't mean to interrupt, but I don't know. We've got a few more minutes that you can go. And then if you would, we have a number of questions in the queue right now. If you want to take a look at them, I'm just giving you a heads up. Okay.
Okay, and I definitely will take questions and stay on for those as needed. So we will continue on here, and thank you for the heads up. So what about MSHA? Let's switch gears. We've talked about OSHA a lot already. First of all, MSHA was a little late to the party, but they do have their own COVID-19 page now. They're largely recommending mine operators to adhere to the CDC guidelines. They are continuing to do their inspections. They made that clear. They're going to do their mandatory inspections twice a year at surface operations, 4 times a year at underground mines. They are going to be doing accident investigations, and they're going to follow up on both safety and health hazard complaints and also whistleblower retaliation complaints. What they are stopping is their guidance, their educational field services who provide advice and assistance on training. Their small mine services are temporarily on a halt, and they're not going to be doing their general walk and talks on some of their emphasis programs right now, like contractor safety, powered haulage, and electrical safety. They ask if you are an operation that is going to shut down during this, please let them know. You do have an obligation to let them know that you're going to be going intermittent or you're temporarily closing, and then you have to notify them again before you start operations. But they have, they're in the same position everybody else is. They've got inspectors who are calling out sick, and so they're limited inspectors. They want to make sure are only going to be traveling to mines that are actually in operation. MSHA has issued some good news, and that is extensions on some of their requirements for annual refresher training under both Part 46 and Part 48. And this is for mine operators and for contractors who do work at mines. If, say, March had been your anniversary month and you couldn't get the training done because you can't have people together, they will give you an extension. You have to notify the district office and let them know that you're seeking the extension. They're not going to deny it. And typically, once the emergency declarations get lifted, they'll give you an additional 30 days to get the training done after that. If you do work at coal companies and you have people who are certified as samplers or to do maintenance or calibration, those certifications will be extended as well. Same thing for the annual audiometric testing. That's your hearing test. But you've got to get permission from your district office before just blowing it off. Otherwise, if they show up and there's no extension request on file, they can issue a 104G1 order and withdraw all of your workers right there on the spot. In addition, new miner training, there is no waiver for that. If you were just getting ready to ramp up production now because spring is here and you were going to onboard a bunch of miners, you have to do their new miner training before you can get them started. They are exploring about whether they're going to allow interactive or computer training for Part 48. They're pretty much allowing that under Part 46 already. But because you have to have an MSHA certified Part 48 instructor physically present, that has been an impediment to Part 48 training online in the past. So stay tuned, keep checking MSHA's website on that, and make sure to document any of the discussions that you get, that you have with MSHA. But beyond that, they are in the process of developing some internal inspection protocols. They're going to be using separate vehicles to travel within the mine, so you're not going to have the MSHA inspector hopping into your supervisor's truck to go drive around the mine anymore. They are minimizing group meetings, but they are going to talk to your individual employees while keeping a safe distance away from them. It's probably, both for OSHA and MSHA, in fact, going to impact their ability to do health sampling, however, because that usually requires, not usually, it always requires the inspector to come within 6 feet of the miner in order to hang a pump on them, and then to check on that pump periodically and remove the pump. So that may be a bit of an impediment to MSHA trying to get its silica rule to the finish line, because up until this point, they had been suddenly trying to capture a lot of silica exposure data. Now, remember, Section 103A of the Mine Act requires you to let MSHA in. They have warrantless search authority, and if you deny them entry, you can be cited and can be fined up to $270,000. Any supervisor or agent of management refusing MSHA access can be personally fined up to $74,000. But if you have an inspector who is sneezing, coughing, again, looks feverish, before just saying, go away and locking the gate in their face, call the district office, get them involved right away, and hopefully they can clarify the situation and maybe send in a different inspector out. Also remember, as I talked about up front, if you're having supervisors now jumping into positions that they don't normally do, make sure to document your MSHA task training for them, because if you don't have that on record, especially if MSHA's on site and they see somebody doing a task in the wrong way, and they ask for those records, that could end up triggering a withdrawal order as well. Dormitory living, we don't typically have that. I just threw this in for anybody who might have operations elsewhere. In the oil sector, the gas, fracking, mining, sometimes it's in remote areas where they have man camps. Usually it is guys in them, so I'll keep using that term. And that is a real route of transmission. OSHA and MSHA have not put any guidance out on this, but strangely enough, the Singapore Ministry of Manpower did. And so I've captured that. It's all the same stuff you're doing at home, cleaning a lot, monitoring people for symptoms, keeping up good hygiene, suspending mass activities, trying to limit the number of people in common areas to minimize interactions. And then if somebody is sick or has to be placed into quarantine because they can't be removed from the remote site immediately, make sure that their interactions with other people are minimized, and leave the food outside the door, leave them fresh sheets or towels or whatever they might need. Certainly you don't starve out people, but you don't want to be going into contaminated areas if it can be avoided. DOT and drug testing, I talked about that already a little bit, in the sense that people are apprehensive about going to clinics right now, and I can't say that I blame them. The Department of Transportation, this is federal DOT now, put out guidance on March 23rd related to the drug and alcohol testing. And they say, you still have to comply, but we recognize that there's going to be challenges in getting the technicians, your medical review officers, your substance abuse professionals. So, try to gather the resources, again, document what you've done. Try to get mobile collection services rather than sending your people to fixed collection centers where people may be there getting tested for COVID-19 as well. If you cannot do the testing, document the reason. And then if the test can be completed later, you're going to have to dig down to the individual mode of transportation, air, rail, commercial drivers, for example. And I've given you the link for the different agencies because they each have their own crazy quilt on this. If you are not able to do DOT testing, period for now, remember that without a negative pre-employment test, you cannot let prospective or current workers perform any DOT safety sensitive positions. And if you're dealing with aviation employees, you can't hire them at all, safety sensitive or non-safety sensitive, without a clean drug test. So DOT certainly does complicate matters a bit for you, but the guidance that they're giving is something I would kind of look at as well for non-DOT workers. And so if an employee expresses health concerns, review the DOT requirements on flexibility for collection. If it's a random test, you may be able to put it off. And be sensitive in terms of whether to classify this as a refusal under 49 CFR Part 40.355I. And in the meantime, think about this if you haven't already, and revisit your backup plans for your collectors, your collection sites, et cetera. So beyond that, and this is where you were probably getting a little bit nervous, I've captured in these slides the information really that you need for each of these standards that I already went through with you. So this slide addresses basically the overarching PPE hazard assessment, as well as the selection of respirators and having a written program, which is required if you're having mandated use of respirators under 1910.134. This again is just really for your reference, and I'm not going to read it through for you because you can do that on your own. But I do want to stress that your respiratory protection programs have to be tailored to the specific conditions of your work site. It has to be a work site specific process that you use for selecting, caring for, using the respirators. You have to train the workers on how to store and maintain them. You have to update the program when something changes. And you have to have a designated felon, I like to say, you're one qualified individual who is in charge of making sure that this program is maintained and that there's continuous oversight. And if you happen to be that person right now, take your responsibilities very, very seriously. We deal with occupational health hazards all the time, but many of them have kind of long-term, often the future chronic effects, that, aren't here in the here and now. You mess this up and a coworker who you've known for 20 years gets ill and dies, that's going to be something, that even if it's not your fault, you may feel some obligation or responsibility for. So make sure you are doing your job in a diligent manner, document the heck out of every decision you make. And if you're not certain if something is going to be adequately protective, err on the side of greater protection for sure. These are all the factors you're going to have to consider in terms of respiratory selection, protection selection. That's bit of a rhyme there. And that is the nature of the hazard, the concentrations of it. Now, for COVID, we don't have permissible exposure limits, so that makes this more challenging as well. How long is the person going to have to wear a respirator? We've seen the pictures now of the healthcare workers with all of the bruises and marks all over their faces from wearing these respirators and goggles all day, but right now, that is part of the occupational hazard. However, maybe there is a less stressful protective gear that they could be wearing depending on the nature of their activities. The fit testing has to be done. Now, OSHA has just said they will waive the annual fit test requirement for respirators For healthcare workers, if there is an existing fit test, a lot of my construction folks said, oh, okay, goody, we don't have to do the fit testing. Right now, at least, they are limiting that waiver to healthcare. Now, if you can't get any way to get a fit test done, you know, because of all of what's going on, again, document the efforts that you have taken. Some employers are saying to me, gee, we were good construction company folks or mining company folks, and we just donated all of our N95s to the hospital. But now, you know, we have silica in the workplace, but, you know, we're just going to have people wear those little cloth masks made out of underwear. No, OSHA has not waived the PPE requirement for other work activities that involve exposure to hazardous chemicals. So don't get messed up on that. We've already talked about the medical issues. Again, the medical evaluations have to be done using Appendix C of 1910.134. I have been told that you can do these via the telemeetings with the doctors, similar to what we're doing with our own healthcare professionals now. And OSHA has said with respect to the N95s that they would prefer that you do quantitative rather than qualitative fit testing. Excuse me, a little cough for you there. I don't think it's COVID. So again, that waiver on the qualitative fit testing and the push toward the quantitative, they were talking about that in the context of the healthcare setting. But if you are in the construction environment or mining and you do quantitative fit testing, they're probably not going to ding you for that as long as you do it correctly. So beyond that, I've kind of just told you all of this already. And then for your training, again, if workers are going to wear respirators, they have to be trained. But right now, you don't want to pull 30 people together in a room and do training. You want to keep it to, you know, really groups of 10 or less, and even that now they're saying, you know, less than that unless you can be more than 6 feet apart. Try to do your training outside if you can. That's another approach to things. I talked about the medical records access rule already, and this just kind of captures that for you. Voluntary use. Now, if you are telling people you can wear N95s, you can wear cloth masks. If you choose, that is voluntary use. You still have to post Appendix D, like in dog, of the Respiratory Protection Rule, 1910.134, in the workplace. That advises the workers how to pick the respirator, how to care for it. It advises them on the limitations, etc. Make sure your employees read that. Have it in Spanish if you need to, and I think it's a best practice to get employees to sign off acknowledging that they are voluntarily wearing these and it's not a mandate. So then if OSHA comes in and they see somebody wearing this over a beard, you're not going to get a citation. Also, advise your workers to keep track of their respirators or their cotton masks to make sure they don't inadvertently pick up somebody else, because that is a surefire route of transmission in the workplace. For construction and mining, some best practices, you know, very often this is outdoors to begin with, which is helpful, but you might have indoor, as you know, 3-4 walls are up and just the roof is missing, or you might be down in a trench or an excavation. Where possible, try to keep at least 6 feet between workers. Stage or stagger your crews. You know, you don't have to have all of your trades there at once unless it's absolutely necessary. Hold your toolbox talks and your other safety and project coordination meetings outdoors. Try to have your office personnel work from home if possible. Make sure your supervisors are walking the walk. This is important. If you're telling everybody that they have to wear a mask and then your supervisors are walking around barefaced, it's not going to be long before people are taking those masks off and putting them up on top of their heads to have a cigarette or communicate with people. Mandate the hand washing. Limit the use of tobacco products. Again, you know, if somebody's taking a cigarette out of their pack and then handing it to another employee because they're generous and they stick it in their mouth, that's a route of transmission. The soap and running water on all work sites where possible. If you don't have anything there, you know, at least have that effective alcohol sanitizer on site. But most places should be able to rig up some kind of running water under the circumstances. And then be mindful of disinfecting tools, equipment, after shift changes, if they're shared areas like kitchens, if people, use the same phone, if people use the same computer. Every time a new person comes on, that should be sanitized before the next person gets in. Your toilet facilities, as well as your porta potties. So these are all things to be keeping in mind. And then OSHA's guidance, we've touched on most of this already, and this summarizes largely what's in their communications. Have your response plans. Stay abreast of the changes in government guidance. Incorporate this into your safety and health management programs or your injury and illness prevention programs. Consider the routes of exposure and the risk. Coordinate. If you're a multi-employer work site, all of the contractors and subs need to coordinate. Consider individual risk factors, but be careful not to discriminate against a worker because they're pregnant or because they're older. Watch out for things like calling it the boomer remover. You do that enough, and one of your older workers might just sue you. And consider how you're going to address the absenteeism, including the cross-training and the staggered shifts. The rest of this we've pretty much covered already. And then the labor law issues, again, I've talked about the ADA. Family and Medical Leave Act applies if you have 50 or more workers in a 75-mile radius, but it only provides unpaid leave for workers who've been with you a year or more and have worked 1,250 hours during that year. Now, watch out, because the DC laws are more protective. They offer 16 weeks of leave rather than 12 weeks. And then the overarching requirements that the federal government is putting now to pay some of that leave. You need to be mindful of that as well. Title VII protects against discrimination based on national origin. There has been some blowback against Asian Americans in the workplace, and the EEOC is going to be on that in a hot New York minute if they get a complaint. Same thing with religious discrimination over potentially the use of respirators. HIPAA, if you have somebody who has tested positive and they tell you, don't go blabbing all through the workplace, hey, did you hear Dave has COVID-19? Especially if you are an agent of management, you have violated the HIPAA rights. Service members, we have had outbreaks on naval ships. We have some people who are in the reserves who may come back into your workforce. You cannot discriminate against somebody in employment solely because of their status as a service member. And then check the EEOC's guidance, which I've given you the link for there, because again, that is evolving. It's got some really good information for small businesses, especially to make sure that you understand what you might need to do relative to COVID-19 when it comes to reasonable accommodations. So I've posed a couple of questions here that I answered for myself, what you can do. Can you mandate medical exams? Yes. In addition, you can require a return to duty note if somebody has been out on leave from this. The EEOC has clarified now that taking a worker's temperature is not going to be considered a violation of the ADA in terms of being a medical exam. So that's good news, especially because some of the states are requiring you to do that. In terms of somebody who has been exposed to a COVID positive person but is asymptomatic, when the CDC is telling people that they have to self-quarantine, the employer can require them to follow that as well. So, can you ding somebody for being absent? Probably not. Check your state laws, check the federal laws on this at this point, because these are evolving. And FMLA leave, it covers you if you are personally sick with COVID-19. That is a serious health condition. It covers you if you are caring for an immediate family member who has COVID-19. But if you are simply self-quarantining and you are healthy, that does not qualify at the present time for FMLA leave. So understand the nuances to these statutes. And then on the reporting, OSHA says if it is a confirmed case of COVID-19 and it is work-related, and that means you've got a straight-faced reason to believe that it could have been transmitted in the workplace, and then it either involves medical treatment, days away from work or restricted duty, you have to put it on the log. And if they become ill enough that they have to go to the hospital or they pass away, that triggers the severe injury reporting requirements I already spoke about that I've captured on this slide. And for MSHA, they say an illness or disease of a miner, and that includes contractors at a mine site, is reportable. You have 10 days. You have to use the form 7001 and do it online. It's reportable if it may have resulted from work at a mine or for which an award of compensation, that's workers' comp, is made. So if either of those two kick in relative to an illness of one of your workers, then you have to report it to MSHA if you are doing work that is under MSHA jurisdiction. So I know that has been a mouthful and a half there, and we have a ton of questions in queue. I'm going to, I guess, turn it back to our moderators here and see if you want to go through these, maybe pick out some of the questions. And if we don't get to all of them and you want to forward them to me, I could certainly try to prepare some answers for you that you could then post on the website to accompany this.
Okay, Adele, we have a bunch of questions in the queue right now. And I think a number of them have been, you've answered them through your presentation, but let's try, and I'm kind of going to randomly pull out a few. All right, and I think you talked about this a great deal. It says, what about homemade dust masks? What will OSHA say about those since N95s are not available?
Okay, that is a great question. And to be very clear, OSHA is not going to accept a homemade dust mask where an N95 respirator is required. So if you are, to use the silica rule again as an example, you're under table 1 in construction of the silica rule and you have to use an APF 10 respirator. That is not going to be one of these cloth dust masks. I've heard of people being very creative, talking about, cutting a piece of air conditioning filter out or, putting a coffee filter in. And, don't they know we're saving the coffee filters to use as toilet paper for, but putting a coffee filter in a sock and putting it on your face is not the equivalent to a NIOSH approved N95 respirator. And so if OSHA shows up, the analysis is going to be talking to the worker. Hey, Dave, why are you wearing that? Oh, the boss told me I had to. Boom. That's a mandatory respirator. Now you're going to be looking at the health hazard evaluation. You're going to be looking at fit testing, medical evaluation. And if you've made a determination COVID could be transmitted in your workplace and all you gave your worker is a sock with a coffee filter in it, you are going to get a citation from OSHA. If you give them an N95, but they haven't been medically evaluated and fit tested, you're going to get cited by OSHA. But if you're voluntarily allowing people to wear the sock with the coffee filter over the face, and OSHA sees that, again, post Appendix D is always a good thing to do. But make it abundantly clear that this is elective, it's voluntary. In my view, you shouldn't be furnishing these, nor should you then be requiring people to take them home and wash them. Oh no, Dave is gone. Did you want me to try answering any more questions, or are we finished here?
Sorry, Adele, I was having a little technical issue. Here's another question. It says, OSHA record keeping. What if an employee converts to a positive exposure during their quarantine period? Do we track for OSHA from the first day placed on OOW or from the day EE is converted?
Okay, again, really good question there. If someone is simply on quarantine because of exposure on the job or off the job, that is not going to be, it's not an illness. It would only be once they are diagnosed with COVID and you've made a determination that it is work-related, that you would then start counting days and you would put it on your OSHA log. So if they're home taking care of a spouse who is suspected positive and they're quarantined because of that, their time off of work does not count as an injury or an illness for OSHA Part 1904 purposes. If they then become positive, it's more likely than not that they caught it from the spouse that they're taking care of. And you as the employer can make the determination that it's not reasonable to consider that work related. On the other hand, if you're a nursing home and you have people who are dropping like flies, as soon as they are diagnosed, then in all likelihood that would be considered work related, and you'd start counting. Today is Wednesday, so if they are diagnosed on Wednesday and their first day off of work is Thursday, you would count Thursday as day one, and then you count weekends, you count holidays. Even if you're closed, you would continue counting until such time as the person either dies or returns to work or quits for a reason that is unrelated to their illness. And you cap it at 180 days.
Okay, I got another one here. It says, in case of remote work mandated by an employer, what are good ways of implementing injury illness reporting? We are now depending on employees to inform us. We usually require telework agreement, but in this case, there may not be one in place for every single employee working remotely.
Yeah, again, a good observation. And to the extent, if you already have policies and procedures for those employees that you allow to telework before the epidemic, you're in good shape. You can expand those and roll them out for all employees who may now be forced to work remotely. And again, you want to have consistency across the board so that you're not discriminating, against workers who might be of certain genders or ethnicities, et cetera. Now, beyond that, if the question, and maybe I'm reading too much into it, but part of that is workplace safety. And I've already had one client ask me, is OSHA going to come in and inspect our homes if we're working from there? And there was some hysteria about this about 15, 20 years ago about ergonomic hazards. And the short answer is right now, OSHA can inspect each workplace once every 165 years. So unless somebody calls in a complaint to them or you have an injury, most employers never see them. The odds that they would just randomly show up at my house to see if my laptop is set up properly, negligible, zero, I would say. However, there are certain tasks that people do from home that could result in reportable or recordable injuries. If somebody breaks their foot and they tripped over the family dog, they may be inclined to tell you that they tripped over a box of files that they brought home. And without a witness and the dog staying silent, that might be something that you would have to consider both for OSHA reporting purposes or recording purposes, as well as reporting to your workers' comp carrier. The nuances are different. You cut your hand making a sandwich for lunch while you're working at home. That's not going to be the employer's fault. It's not going to go on their logs. But if you have a home carpentry shop and you're fabricating things for customers from your home shop and you cut off your thumb, then yes, that employer is going to have to notify OSHA. And yes, that injury is going to have to go on the log. So we always think of homework as being, us sitting there glued to our computer screens, but people do an awful lot of interesting and strange things when it comes to homework. So I don't want it to be myopically focused as simply clerical type of work. People make, fireworks in their homes for that matter. So it's really the nature of the work would depend on what OSHA's interest in it would be.
All right, I have another one. It says, normally we would not be able to request that employees or customers disclose their medical history. However, under these circumstances, when their recent medical history or that of their immediate circle could impact the health of others, how much information can we require employees or customers to report? I'm specifically referring to a school environment prior to the return of staff and students.
Yeah, that is going to be a tough one to tackle. And I'm not really punting on this. The short answer is for your own employees, you want the minimum information possible about any of their health conditions, because once you have knowledge, for example, that somebody has a pre-existing condition that is covered under the ADA, you can't unring that bell, and that may give them protected status, for other reasons. Narrowly focusing in on COVID, the EEOC is allowing more latitude in terms of inquiries, in terms of things like doing the temperature testing. You could certainly ask an employee or an applicant, is there any reason why you can't safely or healthfully perform all of the assigned tasks? That is a basic inquiry that is certainly entitled. And if they say, well, I can do it, but I need reasonable accommodation because I have COPD or I'm a recovering cancer patient, they are at elevated risk. But you can't refuse to hire a teacher who has a history of cancer simply because you think that they might be more predisposed to getting COVID-19. So this is very much going to be an individualized assessment. In terms of customers or students or parents in a school environment, I don't think that the employer is going to be able to make a case-by-case determination on that. I think it's going to be pretty much dictated by the school districts in terms of what clearances are going to be required. So I think that is probably premature for me to try to tackle. If you have school nurses, they would be subject to the same healthcare protections that other healthcare workers are.
Okay, I've got one more I'm going to ask, and then we're going to have to, we could probably go all day, but this one sounded pretty good. It says, what can we do about a worker who is in an essential job, employee who does not want to work because he is afraid to work? He's over 60 years old.
Well, those are some of the dicey situations. And as I said earlier, having some empathy is probably a good thing. If you force somebody to come in, I'm a bit older, Dave, you're there too, and some of you on the phone maybe, but there used to be a comedian named Jack Benny. And one of his routines was being robbed at gunpoint and the robber saying, your money or your life. And he stands there and doesn't say anything, your money or your life. And finally the robber says, your money or your life. And Jack Benny says, I'm thinking. Well, if you've got a high-risk employee over 60 in an essential job who tells you, I'm really afraid to come in because this is a high-exposure job and I'm afraid I'm going to die, respecting that is probably a good thing. If you force somebody to put their life on the line, they may do it. And if they die, you're going to have the workers' comp to deal with. You're going to have survivor benefits to deal with. You're going to have your conscience to deal with. But this is tough. I know a lot of companies are going to be dealing with this. One of my best friends is an ICU nurse at one of the Washington hospitals. She's over 60, has some health issues, and her husband is over 70 with some health issues. And she's going into work every day, but her family is living in terror. And she's doing everything she can, like, changing out of clothes in the garage before she goes into the house, where it's the new normal, walking into your house naked and saying, honey, I'm home. But as a practical matter, she's never going to forgive herself if her husband catches this and passes away. So these are all really, issues of conscience, and probably a good way to close this. And I didn't come up with this. I heard somebody else say this. How you treat your employees now during this crisis is how they're going to view you in the future. So I'll leave it at that.
All right, Adele. Well, hey, everybody that participated today, I want to thank you all. Adele is just an encyclopedia of information, and we could go on with this for hours and hours and hours. I just want to thank you all for participating. I want to thank Adele for presenting an excellent presentation. And I would ask you all to stay tuned. There were questions about slides being available. We did record this, so please do us a favor. Stay tuned on our website. Check it. It's ChesapeakeSC.org, and we will have some information up available for you in the near future. And stay tuned. We're going to do more of this. This worked out pretty good. We had a great participation, and we're looking forward to do it again more in the very near future. So once again, thank you all for participating, and we hope to see you here again. That's it.